Hello, everyone, and welcome back to our channel. Today, we're delving into a topic of paramount importance, your heart health. In this video, we'll be discussing the 10 early warning signs of heart disease. So, stay tuned because your heart matters. Heart disease is a leading cause of death worldwide, and what's alarming is that it often goes unnoticed until it becomes a major health issue. We believe that knowledge is power, and understanding the early warning signs can make a world of difference in preventing heart problems. So, let's get started. Before we dive into the 10 early warning signs, it's essential to understand what heart disease actually is. Heart disease refers to a range of conditions that affect the heart's structure and function. It can include coronary artery disease, heart failure, arrhythmias, and more. But what's concerning is that these conditions often develop silently, without any noticeable symptoms. How can we detect heart disease in its early stages? What signs should we be looking out for to ensure that our hearts remain healthy for years to come? That's precisely what we're going to explore. We've carefully selected 10 early warning signs that you should be aware of. These signs can vary from person to person, and not everyone will experience the same symptoms. However, being mindful of these warning signs can help you take proactive steps towards a healthier heart. 1. Chest pain or discomfort, angina. Chest pain or discomfort, known as angina, is a pivotal indicator of heart disease. Examining this symptom through a medical lens reveals crucial insights. The nature of angina pain is distinctive, often described as tight, squeezing, burning, or pressure-like. It stems from inadequate blood supply to the heart muscle due to narrowed coronary arteries. This discomfort typically emerges during physical exertion or emotional stress, when the heart requires more oxygen-rich blood than the compromised arteries can provide, resulting in stable angina. However, unstable angina can occur unpredictably, even at rest or with minimal exertion, signifying a more urgent situation. The duration of angina pain is usually brief, lasting only a few minutes. Recognizing this temporal aspect is vital, as prolonged discomfort may signal a heart attack, necessitating immediate medical attention. Rest or medication like nitroglycerin can often alleviate angina, highlighting both diagnostic and therapeutic value. Additionally, associated symptoms like shortness of breath, nausea, sweating, or lightheadedness can further underscore the cardiovascular nature of angina. Notably, some individuals, particularly diabetics, may experience silent angina, without chest pain, but still at risk. 2. Shortness of breath, dyspnea. Shortness of breath stands as another significant early warning sign of heart disease when it occurs, particularly with physical exertion. Shortness of breath is a symptom intricately linked to the heart's capacity to function optimally. When the heart faces challenges in pumping blood effectively, oxygen-rich blood may not be adequately supplied to the body's tissues, including the lungs, leading to sensations of oxygen deficiency. Dyspnea related to heart disease primarily emerges during physical activity, termed exertional dyspnea. It arises as the heart's demand for oxygen surges during exercise, and when conditions like coronary artery disease hinder the heart's capacity to meet this demand, dyspnea becomes evident. As heart disease progresses, dyspnea can manifest during less strenuous activities and even at rest, signifying an advanced stage of the condition. Orthopnea, on the other hand, signifies discomfort lying flat, but relief when upright, a potential sign of heart disease-related fluid accumulation in the lungs. 3. Fatigue. Unexplained fatigue, characterized by persistent tiredness and lack of energy, serves as a noteworthy early indicator of heart disease. This symptom is rooted in the heart's diminished ability to efficiently pump blood. When the heart struggles to maintain adequate blood flow, various organs and muscles receive less oxygen and nutrients, resulting in constant fatigue. The onset of fatigue can be gradual or sudden, and its progression varies depending on the severity of heart disease. 4. Dizziness or fainting, syncope. Experiencing dizziness or fainting episodes can signal underlying heart issues. These occurrences often result from a drop in blood pressure or insufficient blood flow to the brain. Understanding the type of syncope is crucial. Distinguishing between vasovagal syncope, which is often triggered by emotional stress or dehydration, and cardiac syncope, directly related to heart function, including arrhythmias or structural heart problems. 5. Palpitations. Palpitations, the sensation of an abnormal heartbeat, can serve as an early warning sign of heart disease. They often result from disruptions in the heart's electrical signaling system, leading to irregular heart rhythms or arrhythmias. Palpitations can occur suddenly, intermittently, or at rest, lasting from seconds to minutes. 6. Swelling or edema. Swelling or edema occurs when fluid accumulates abnormally in body tissues. When the heart becomes weakened or impaired, it may struggle to maintain proper blood flow, resulting in increased pressure within blood vessels. This elevated pressure can force fluid to seep out of blood vessels and into surrounding tissues, leading to noticeable swelling, often seen in the legs, ankles, and feet, referred to as peripheral edema. In more severe cases, edema can also affect the lungs, causing pulmonary edema. The progression of edema may vary, and it can initially be mild but become more pronounced as heart disease advances. Recognizing edema, particularly in dependent areas of the body, should prompt individuals to seek medical evaluation. 7. High blood pressure, hypertension. High blood pressure, often termed hypertension, is a significant risk factor for heart disease. It operates by elevating the force of blood against artery walls, potentially leading to artery damage and heart-related complications. What makes hypertension particularly concerning is its often silent nature in the early stages, with many individuals remaining unaware of their condition. Diagnostic criteria define hypertension as having a consistently elevated blood pressure reading, typically at or above 130 to 80 millimeters of mercury. The consequences of untreated hypertension can be severe, including increased strain on the heart, arterial damage, and heightened risks of atherosclerosis and coronary artery disease. 8. Excessive sweating, especially night sweats, nocturnal diaphoresis. This symptom may be linked to increased sympathetic nervous system activity, triggered by cardiac conditions like heart failure, arrhythmias, or heart valve problems. Night sweats, which occur regardless of room temperature or excessive blankets, can disrupt sleep and persist independently. While excessive sweating can have non-cardiac causes, persistent and unexplained night sweats, especially when coupled with other heart-related symptoms, warrant comprehensive medical evaluation. 9. Indigestion or stomach discomfort. Indigestion and stomach discomfort can occasionally be associated with heart disease. These symptoms may stem from referred pain or cardiac issues. Particularly those involving the heart's lower part or diaphragm irritation can manifest as sensations of fullness, burning, bloating, or pain in the upper abdomen. Such discomfort can mimic gastrointestinal problems like acid reflux or gastritis. 10. Pain or discomfort in the neck, jaw, or throat. Pain or discomfort in the neck, jaw, or throat can, in certain instances, be associated with heart disease. This symptom can be attributed to referred pain, where pain signals from the heart are transmitted to areas served by the same nerves, including the neck, jaw, and throat. The discomfort may manifest as aching, pressure, or burning, with varying levels of severity and duration. Any persistent or unexplained symptoms, especially when occurring alongside other concerning indicators, warrant prompt medical evaluation to identify the underlying cause and ensure timely intervention, crucial in preventing more serious cardiac events. However, we can reduce the risks of heart disease by adjusting your diet and adopting appropriate treatment measures. So, let's review the key steps to achieve a healthy heart. Adopt a healthy diet, incorporate more fruits, vegetables, whole grains, and omega-3 rich foods while limiting high cholesterol and fast food options. Maintain a healthy weight, strive for a balanced diet and regular physical activity to prevent obesity, a significant risk factor for heart disease. Exercise regularly. Engage in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous exercise per week, including strength training. Quit smoking. Stop smoking and avoid exposure to secondhand smoke, a leading cause of heart disease. Reduce stress. Employ stress reduction techniques like meditation, yoga, or leisure activities to alleviate stress, which can impact heart health. Limit alcohol intake. Consume alcohol responsibly and within recommended guidelines to minimize heart disease risk. In conclusion, your heart health should never be taken lightly. Recognizing the early warning signs of heart disease can be a lifesaver. Remember, your heart deserves the best care, and we're here to help you on that journey.